All right, let's shift our focus to mental health in the workplace now. Alistair Carmichael, expert associate partner, people and organizational performance practice at McKinsey Company, joins me now. Alistair, thanks very much for your time this afternoon. We've all had those days, right, where we're just drained from work, we're stressed, we're unhappy. Right now, can you tell me what are the biggest complaints about workplace environments in this region particularly, and do they differ from the West?
So what we see in research that we've done this year, 2023, across 32 countries, is that we are continuing to see some big challenges in our region. So for instance, in Singapore, 29% of employees are reporting signs and symptoms of burnout. That's above the global average. So what it tells us is that for every workplace, for every one of our leaders, there is a challenge that we still need to meet.
You mentioned 32 countries. Can you go through them, a few of them? Which countries score the lowest in terms of mental wellness? And is there a difference when we take into account socioeconomic lines, how wealthy a country is?
So it is interesting when you look across them. One of the things that you see is that culture, national history, expectation and attitudes around mental health do have an impact in this place. But there isn't a country that we're looking at, there isn't a country globally that we look at that doesn't face some of these challenges. So for instance, you are seeing there that almost 1 billion people in the previous WHO are reporting mental health conditions, and we know that that's only gone up. If we look across our region, we do see some variation. So burnout, I mentioned 29% in Singapore, more like 19% in Indonesia. Now, that may be a good sign in that it's slightly lower. It's still 1 in 5 people.
The company has a yoga class today that I might pop into after our interview, but that touches on culture, right? Is there corporate will to change environments and culture for the better for employees? And I'm curious, does it stem from authentic concern, or is it because it's just good for the bottom line?
So I think it's a great question. What I do see, and I've been in this space now for about 9 years, we have seen some real change across that time. The conversation is different today than it was 5 years ago, and COVID accelerated that. It normalised a lot of the conversation. That said, there is still a long way to go, and the motivations can be different. For some, it is genuine care, and some it is bottom line. And at the heart of it, it is actually good business to get this right. The potential return for any employer in doing this is double-digit in terms of productivity benefits. Now, the question, though, is what do you do about it? And you mentioned wellness and yoga-type interventions. They are part of the mix, but what becomes even more important is two things. One is, what are the leaders doing and how are they role modelling, and are they being authentic in creating a safe environment? And secondly, how is your environment itself contributing or harming the mental health of employees?
Now, you work with companies on organizational transformation and change. What does that look like? How receptive are these businesses to change?
Look, I think we've all gone through such an incredible period of change and challenge across the last few years with COVID. And that has certainly flowed through into employees experiencing challenges. What we see in terms of the burnout stats, we wouldn't expect it to be the same but for COVID. So change in a lot of ways has become the way of life. And employers that I deal with across sectors, across industries, across our region and beyond are at different stages of their comfort with change. What I think that we can all do, and I think this starts with leaders, is to look for how we can boost our resilience in the face of change. And that is about building our capability, building our capacity, and making sure that we're looking after ourselves and we're giving our employees, we're giving our people the chance to have the space to do it so they can live a more balanced life.
Alistair, during the pandemic, we saw a real rise in telehealth care services. What about virtual mental health care? What's available right now? And is it as effective as, say, in-person support?
There's been a big uptick in the availability of tech and virtual-enabled solutions, and it's particularly important in some hard-to-access or hard-to-reach areas. It's part of the solution, but it's not the whole solution. There is some interesting research looking at whether or not it is as effective, and it becomes challenging, particularly when you're looking at diverse cultural groups. But what we do see is that it can provide a part of a mix. So for an employer, making sure that you've got adequate healthcare that is provided through virtual setups and virtual systems can make a big difference. But what I would say, it's only part of the story. And so you can have the best tech-enabled support, but if your broader cultural environment is contributing to poor mental health outcomes, it won't ultimately make a difference.
Now, let's say a CEO was watching our conversation right now and thought, you know what, I want to do something. What is the most immediate thing a company can do to support the mental wellness of their staff? What are some practical tips?
So 3 things come to mind. The first is, as a leader, invest in your own education. And I have this conversation with CEOs and other senior leaders all the time. What can they do? What they can learn? There's lots of information out there to make sure that they build their understanding. The second part of it is, can they boost the capability of themselves and others to be able to spot a sign of when something's not working out and have a first conversation? That's not making every employee a counsellor or a therapist, not at all. It's boosting the basic capability so you can spot a sign and you can intervene. And then the third thing that I would do is just, are you clear about what's driving what's going on in your workplace? So engagement surveys will not tell you how mentally healthy your workplace is. So can you as a CEO say, hey, I want to get sharper on that. I want to get sharper on measurement. So for me, it's those 3 things. Get smarter and invest yourself. Boost the capability of your people. Both things can be done quickly, and then have a look at your measurement. That might take a little bit longer, but it pays off in spades.
We've been talking about the employer, the heads of these companies, but let's talk about the other side. What role do employees play in ensuring their own mental wellness at work?
They play a huge role, actually, but I think we've got to always make sure that we're not putting all of the burden on employees to navigate through. But their experience is defined a bit of where they are in the workplace. So interestingly, on the burnout stats, if we look at 29% for Singapore, it's actually the highest at the most junior and the most senior. The middle is a little bit lower, which tells us the experience is different. So if you're as an individual, the opportunity and the area to take action is, 1, get to know what matters for you, what is driving your energy. 2, look for ways that you can be part of a community, that you can feel like you can belong, so you can actually connect with others and support you. And importantly, do what you can do in the workplace to help it become a safe space. Unfortunately, it's somewhere in the order of just under 50% of people in our workplace, so just over 50% of people in our workplaces in the region say that they feel safe to speak up about their challenges.
Great. It's wonderful we're having this conversation, and I really appreciate your time today. That is Alistair Carmichael, Expert Associate Partner, People and Organizational Performance Practice at McKinsey Company. Thank you.